Now my guest joins me on the line now. I know you didn't want the reggae music to stop, but don't worry, keep it right here. We'll be playing a lot more great music that punctuates great conversations. Joining me on the line now is my guest, Dr. Micheal Vhere. Doc, good evening, and thanks so much for joining us.
Good evening, Catherine. Good evening, listeners.
Wonderful. We want to talk a little more about this flu outbreak in Harare. Tell us a little bit about the situation. What's the current status, Doc, of this outbreak, and what's the risk of complications, out of these influenza cases that you're recording?
Okay. Thank you very much for that very, very important question. Yes, we have got this influenza that is currently happening in Harare. But maybe just to also mention that it's not only affecting Harare. I think we have also heard even in the region that there has been an increase in the numbers above the normal on the numbers of influenza cases generally. So it's not only Harare, so it's a region-wide problem. So in general, what I can maybe just put so that people can have an idea of what really influenza is, so that they can identify cases even in their communities. So influenza is a disease that is caused by a virus, and usually presents, it's either a very mild disease or a severe form of disease. So, but most of the cases, more than 90% of the cases are very mild. So they present like flu, like a flu-like illness. And so, but in severe cases, then the lungs are affected so much that somebody would then require oxygen. And then, so this means that they require admission for the oxygen to be administered. And so this is usually what usually complicates the situation, especially when people then get to the stage of requiring oxygen. So, fortunately, as I said earlier on, that these cases of severe form of the disease are few, and the majority are very, very, very mild. So to date, for Harare, speaking for Harare City in particular, to date we have recorded more than 1,400 cases of influenza, and these have been recorded mainly in the high density suburbs, but it's generally in the whole city of Harare. Because we see that even in areas like Budiriro, Glenview, Glenora, even in the lower density suburbs as well, like Borodale and other areas, we have actually noticed that we also recorded cases in those areas. But I think what is important is for us to know what is the causative organism for this influenza virus. So usually, most of the time, the influenza virus is that, okay, especially during this time of the year, in the winter months, usually it's caused by influenza type A. There are four types: type A, B, C, and D. But type A is the one that is most common in humans.
Okay.
And this is what so far we have been able to isolate in the cases that we have recorded so far. I think offhand, I think I can say maybe we've recorded around 3 or 4 influenza A cases. So the assumption is that current stage that we are experiencing is due to the influenza A virus.
Doc, I think it's important maybe that we get into what the common symptoms of influenza A virus are, and what is the difference between influenza A and other types of influenza.
Wonderful. So in terms of the presentation, so it's typical of what we call flu. Somebody presents with a running nose, a sore throat, a fever, that is temperature above, usually they say above 38.5. Then they can also have cough. Then they can also then have what we call shortness of breath or respiratory distress, where they have got difficulty in breathing. And this difficulty in breathing is as a result of the lungs being affected by the virus, the influenza A virus. And to the extent that the oxygen exchange at the lung level won't be happening optimally. So this is when people then start getting that shortness of breath that I'm talking about. So in very severe cases of that, people actually die from that deprivation of oxygen, because the lungs would have been severely affected. We call it a viral pneumonitis, where the lung is severely affected because of the virus. So that is those are sort of the symptoms. But as I said earlier on, most of the cases that we see are very mild cases. Then the few are then the complicated cases that we record. But fortunately for Harare, as of now, we have not recorded a confirmed influenza death. So yeah, that is the current position as Harare, that we have not recorded a confirmed death of influenza.
Would you say, Dr. Vhere, that the cases recorded in Harare, are they mild? Are they severe? How would you classify the influenza A cases that have presented so far?
So far, the majority of them are mild cases. In fact, most of them we have had a few admissions at our infectious disease hospital, that is Beatrice Infectious Disease Hospital and Wilkins. We have had a few admissions for those patients who would require supportive treatment. But out of the 1,400 cases, less than 50 cases have been admitted. So it just shows you how mild the disease has been for most. But obviously, if somebody then, those complicated cases, no matter how few they are, somebody may actually die from it. So we don't want to lose any life because of influenza.
Absolutely. You're so right, Doc. Tell us a little more about the precautions that should be taken, and are there any high-risk groups or populations who's more at risk of contracting or catching this particular type of influenza?
Okay, so what we have noticed actually during this outbreak is that more than 40% of the cases are children below the age of 4 years. And a significant proportion as well is attributed to people above 65 years of age. And scientifically, we know that these age groups that I've talked about, they have got a weaker immune system. So they are prone to be vulnerable to such infections. And not only them, even people on cancer medications, even people with malnutrition, even with people with other chronic diseases as well, like diabetes, they are also at risk of getting such infections because their immunity is not to that level of those in the other categories. So this is the risk profile for influenza.
You talked about, children being, one of the high-risk groups, particularly those under the age of 4. How can parents protect their children, particularly those in this age group, from getting the influenza A virus?
Okay, so I think most of our listeners may actually appreciate that since this is a viral infection, usually with viral infections, the best form of prevention is vaccination. And I think we all remember the COVID-19, even all the other vaccine preventable diseases, most of them are viral infections. So the best form of prevention is vaccination. But however, what for Zimbabwe, we have not had major outbreaks of influenza like what happens in Europe. So we are at a public health level for Zimbabwe, we do not routinely administer influenza virus vaccine. But however, it does not mean that this is not found here in Zimbabwe. The vaccine, it is there, it is available in private. But obviously, if at a national level, a public health point of view, we cannot be utilizing. We cannot be talking about the availability in private. It has to be in the public sector. But usually, a disease, for it to then to be classified as such that it warrants vaccination at a population level, there should be enough reason, enough scientific evidence, or even in terms of morbidity, death, and etc., so that people, the country then is prepared to invest so much in a vaccine. So for us, I think maybe due to climate change, I think the drop in the temperature that we experienced recently, I think we haven't been experiencing this in a long time. So maybe it's also bringing in different forms of these influenza A viruses because of the probably the global warming or the climate change that is coming upon us recently. Yes.
I tend to agree. It has been very cold and the rain and so on. So, the seasons are definitely changing. And maybe these are some of the effects. You did talk about the vaccines. Are there any other antiviral medications or supportive treatments that can be used in treating this influenza?
So, yes. So what happens usually is, I think it's important for us to realize that I said earlier on that those who are being affected have got a lower immunity. So anything that will then boost your immunity would actually assist. So a healthy living lifestyle, eating a well-balanced diet, keeping yourself warm, because this cold that we're experiencing also affects your immunity. So keeping yourself warm is also important. So those are some of the interventions. So take a lot of fruits and foods with minerals and vitamins, especially vitamin A, C, E. Those are important because that they actually help to boost the immunity or to strengthen the immunity. So those are some of the few things that people can also do. And please keep yourself warm because this cold also affects the immunity.
Hansi, keep yourself warm. Very, very important. If you're just joining us, we are speaking to Dr. Micheal Vhere. He's with the Epidemiology Department in the Harare City Council, and we are looking at the influenza outbreak in Harare. What has the public health response been to the same? And he is giving us some very important tips on how to stay warm, how to beat this influenza, get vaccinated as well. But besides vaccination, boost your immune system and stay warm. Now, Dr. Vhere, you did tell us that there are other areas affected even beyond Harare. But coming back to Harare, are there any specific guidelines for high-density suburbs like Mbare, Glenview, and Budiriro to curb the spread of influenza, since those are some of the areas where you've recorded some high numbers?
Okay, so in terms of how this disease is transmitted, I think we all know that this is a respiratory infection, and I think the measures that we usually take when dealing with COVID-19 are still the same measures that we should also put into play when dealing with the influenza viruses. So I think it's important that people keep that social distance, even wearing of masks, especially in public places, so that so that transmission actually can be reduced. So most of the interventions that we were applying during the COVID-19 also apply to the influenza.
I have
even washing of hands as well, because it also stays on surfaces for a long time as well, just like what happened with COVID-19.
I have noticed quite a lot more people wearing masks in public. Do you recommend this as a precautionary move and something that should be done more widely by more people?
Well, yes.
Or who should be wearing a mask? Maybe let me put it that way. At the moment.
So at the moment, the issue is the difference between what is happening now, COVID-19 and the influenza. COVID-19 had a higher case fatality ratio. Case fatality ratio is just the number of people who die from those who are infected. So with the influenza, in terms of the death, as I told you, in Harare, we haven't had any confirmed death. Of course, there's lots of morbidity because people actually are more because of the influenza virus. In terms of those interventions now, that everyone should be putting on a mask, or we should close schools or close whatever. Those kind of interventions at that level would probably apply to a disease that is ravaging more than what we are seeing at the moment. However, we know that it's very discomforting, the influenza virus. At a personal level, you might actually then choose to wear a mask, especially if you go into public places where people are coughing or sneezing, and you don't want to catch the cold. You can actually put on a mask.
Very important there. Thank you for clarifying that, Doc. But if I get you right, there might not be, you're not putting it at the same level as how COVID-19 was ravaging, but it is still a cause for concern.
It is a cause for concern because we are losing a lot of man hours at our workplaces because people, they are suffering from influenza. They then stop coming to work and we lose a lot during their absence.
We've got some questions coming in here, Dr. Vhere. This one is from Patrick, who says, back then, flu used to be there, but it's not as strong as what we're witnessing nowadays. Are these viruses not being manufactured by people? And what can we do to protect ourselves? Some of these vaccines, we can no longer trust them. So this is a concerned citizen here. Patrick saying, are the strains rather not mutating? And can we trust vaccines? Well, how can you answer this concerned listener?
Yes, very, very important concern. I think the issue of mutations comes in, especially with viral infections. We know that viruses mutate, and with the influenza A, we have got different subtypes. And these different subtypes have got different levels of virulence. If I'm talking about virulence, I'm talking about the ability to cause severe disease. So these different subtypes. So we might be having a virulent subtype circulating at the moment. But this is probably why we are getting maybe more severe forms of flu than we were seeing previously. However, we are still in the process of verifying the subtype. We have actually established what we call Sentinel South site in Harare with the help of WHO, where we are taking samples from those who present with signs and symptoms. And these samples, we are taking them to our national microbiology reference lab. And some samples are also being sent to South Africa so that we actually verify some of these subtypes and know what we are dealing with.
This one is coming from 979, this is Comrade Mazivisa in Crow Hill, who says, I wake up with a swollen head. a swollen head and dripping nose. Can this be the new viral infection of this flu bug? Are those symptoms do they correspond to the influenza A virus, Doc?
So I think such symptoms, I think the best would be to visit the nearest clinic so that there is a proper assessment. All our clinics are attending to influenza cases. So I think the best would be to attend to visit the nearest clinic, and a professional, a clinician, would then assess those symptoms and decide what is the best way forward for such cases.
And just as we close off, Dr. Vhere, what would you recommend in terms of isolation? I don't want to use the Q word since we're not.
Yes.
So we're not going into that zone yet. So what's the recommended isolation period for individuals who may be diagnosed with this influenza A virus, and what measures can they take to reduce the transmission to others?
Okay, great question. So at the moment, we not really, as I said earlier on, because of the nature of what we are seeing, we are not really recommending isolation or quarantining people. But however, we know that if, let's say, somebody has got those signs and symptoms, we actually advise them from getting into, if, for example, going to work, because obviously they would then spread the disease. So usually we want them, the first 3 to 5 days are the most infectious before you get the symptoms, and just after the symptoms. So the first 3 to 5 days of getting that infection are the most infectious. So during that period, that's when somebody is highly infectious. But after that, they might be coughing, they might be presenting with symptoms, but they will no longer be infectious at that moment. Because what would then be happening is they would have had maybe secondary bacterial infections, which would then be causing those symptoms. But otherwise, the viral infection would have subsided, thus rendering them non-infectious.
And the last question, this one comes from 883, who says, where did the primordial strain originate from?
Sorry, the primordial.
Yes.
Maybe our listener can explain more on that as well, so that I really understand where they are coming from.
I think arongozama kuda kuti yekutanga yacho yakabva kupi, the prototype of the virus. Kuti yakatangira kupi.
Okay. So these viruses have always, as I told you, there are 4 types of viruses, right? A, B, C, and D. And the influenza A is the one that is most common in humans. Influenza B as well is also in humans as well. But when you go to viruses like the C and D, these ones are more in animals. For example, I think the G is mostly in pigs, while C is in cattle. So we see that these viruses have always been there, especially the influenza A viruses. They've always been there. But I think the issue of mutation, as I mentioned earlier on, these mutations actually change their virulence. So we see that sometimes some of the viral infections then become more severe than what they used to be before.
Dr. Vhere, we fast run out of time as we were talking about a very important issue, that there is indeed an outbreak of influenza in Harare and in Zimbabwe as well. And we were looking at the public health response. In closing, Dr. Vhere, to our listeners, how can they keep themselves influenza-free in this cold period?
Wonderful. So I think my advice would be, let's stay warm and eat healthy. Eat foods with that contain a lot of minerals, vitamins. These actually help to improve your immunity. And also as well, let us try and also protect ourselves, especially when we feel that we are in public places where people might, where we might actually get infection. I think it's important that you may protect yourself. Even masking up in such situations, I think it's not a problem. And lastly, but not least, the issue of vaccination. I think it's something that some people might need to consider, especially those in the categories that I mentioned earlier on, that they are more at risk of even dying from this kind of infection. The elderly, very elderly, and also those with some of these chronic diseases that I mentioned, like diabetes.
Dr. Vhere, thank you so much for taking time out to speak to us, Joshua. And we're so glad that you were able to give us some practical tips how we can keep ourselves flu-free. And to those who are suffering from this influenza, I hope you can actually get yourself treatment and please isolate yourself or just take those added measures, as Dr. Vhere says. Dr. Vhere, thank you so much. We look forward to speaking to you very soon. Have a good night.
Okay, thank you so much.